You know, there's a question I hear almost every week in my clinic, and I can tell from the way patients ask it, looking down, voices dropping to a whisper, that it weighs on them. It's about something deeply personal, something many people wonder about but rarely feel comfortable asking out loud. And I want you to know there's no reason to feel embarrassed. This is about your health, and your health deserves honest answers. Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon, and if you're ever facing questions or concerns about your urological or sexual health, stay with us. We're here to help you understand your body with clarity, compassion, and respect. Today, we're going to talk openly about oral sex and swallowing, what the science actually says, what the real risks are, and how you can protect yourself while maintaining intimacy and trust with your partner. If this kind of straightforward, evidence-based conversation is helpful to you, please subscribe and share this with anyone who might benefit. Let's get into it. So let's start with the question itself. Is it safe to swallow semen during oral sex? I've heard patients phrase it 100 different ways. Some ask if it's bad for you. Others wonder if it's nutritious. Yes, that's a real myth we'll address. And many just want to know, could this make me sick? The truth is, this isn't a simple yes or no question. It requires us to look at a few different angles: digestion, nutrition, and most importantly, infection risk. Because the real answer depends on context, on your partner's health status, and on the precautions you're taking. Before we go further, let's talk about what we're actually discussing. What is semen? What's in it? Semen is the fluid released during ejaculation. And here's something that surprises a lot of people. Sperm, the cells that carry genetic material, make up less than 5% of that fluid. The rest, more than 95%, is seminal fluid. And the majority of that seminal fluid, it's water. In fact, over 80% of it is just water. The rest contains fructose, a type of sugar that provides energy for sperm to move. There are also small amounts of protein, enzymes, minerals like zinc, and a few other compounds. The fluid is slightly alkaline, which helps protect sperm in the acidic environment of the vagina. But when you strip it all down, you're looking at mostly water, a bit of sugar, and trace amounts of protein. So why does this matter? Because understanding what semen actually is helps us evaluate whether swallowing it poses any real physical risk. Let's break this down into 3 parts: digestion, nutrition, and infection. Part 1, digestion. From a purely digestive standpoint, swallowing semen is not inherently harmful. When it enters the stomach, your body treats it like any other substance. Stomach acid is incredibly strong. It breaks down proteins, sugars, all of it. The volume is small, usually less than a teaspoon per ejaculation. There are no toxic compounds in healthy semen, so your digestive system can handle it without issue. That said, this assumes the semen is from a healthy partner. We'll get to the infection part in a moment, but purely from a can my stomach process this perspective, yes, it can. Part 2, nutrition. Now, this is where a lot of myths come in. You may have heard that semen is high in protein, that it's like a natural supplement, that it's good for your skin or your health in some vague wellness influencer kind of way. Let me be clear, this is not supported by science. Yes, semen contains protein, but how much? In one typical ejaculation, you're looking at about 200 to 500 milligrams of protein. To put that in perspective, one egg white contains roughly 3,600 milligrams of protein. So you'd get far more protein from a single egg than from semen. What about calories? One ejaculation contains roughly 5 to 15 calories. That's less than a single piece of candy. The vitamins and minerals present, zinc, vitamin C, calcium, are there in such tiny amounts that they offer no meaningful nutritional benefit. The purpose of semen is reproduction, not nutrition. It's designed to carry sperm to an egg, not to nourish the person receiving it. So if anyone ever tells you swallowing is healthy because of the nutrients, you can confidently tell them that's a myth. Part 3, infection risk. This is the critical part. Here's where we need to slow down and pay close attention, because this is the real medical concern. The biggest risk associated with swallowing semen during oral sex is not the semen itself. It's what might be in the semen, specifically bacteria, viruses, and other pathogens that cause sexually transmitted infections, or STIs. During oral sex, the tissues inside your mouth and throat, the mucous membranes, are exposed directly to your partner's bodily fluids. These membranes are thin and porous, much more so than skin. That makes them vulnerable. Pathogens can enter through these tissues even if there are no visible cuts or sores. And here's the tricky part. Many STIs don't show symptoms, especially in the early stages. Your partner might look completely healthy, feel fine, and have no idea they're carrying an infection. This is what makes STI transmission so insidious. It's often silent. Let me walk you through the infections that can be transmitted through oral sex: gonorrhea and chlamydia. Both of these bacterial infections can infect the throat. We call this pharyngeal gonorrhea or pharyngeal chlamydia. Sometimes it feels like a bad sore throat, but often there are no symptoms at all. You could be infected and not know it, and you could pass it to someone else without realizing. Syphilis. Syphilis is making a comeback in many parts of the world, and it's concerning. This infection can cause sores in the mouth, known as chancres. These sores are often painless, so people don't always notice them. If untreated, syphilis progresses through stages and can cause serious long-term health problems. Oral herpes, caused by HSV1 or HSV2, can be transmitted through oral sex. It can cause painful sores on the lips, mouth, or throat. Once you have herpes, it stays in your body for life. Outbreaks can recur, especially during times of stress or illness. HPV, human papillomavirus. This is one that doesn't get enough attention. HPV is incredibly common, and certain high-risk strains can be transmitted through oral sex. These strains can lead to oropharyngeal cancers, cancers of the throat, tongue, and tonsils. Over the past few decades, the rates of these cancers have risen significantly, and HPV transmitted through oral sex is a major factor. This isn't fear-mongering, this is real documented medical evidence. I've seen patients in my practice dealing with the consequences of HPV-related throat cancers, and it's devastating. HIV. The risk of HIV transmission through oral sex is lower than through vaginal or anal sex, but it's not zero. The risk increases significantly if there are cuts, sores, or bleeding gums in the mouth. If your partner has HIV and you have any open tissue in your mouth, there is a risk of transmission. So here's the bottom line. If you don't know your partner's STI status and you're engaging in unprotected oral sex and swallowing, you are taking a real health risk. Not because of the semen itself, but because of what it might carry. Allergic reactions. There's one more rare but real possibility I should mention: seminal plasma hypersensitivity, or semen allergy. Some people have an allergic reaction to proteins in semen. Symptoms can include itching, swelling, redness, or hives. In extremely rare cases, it can cause anaphylaxis, a severe allergic reaction. If you experience unusual symptoms after oral sex, don't ignore them, see a doctor. So what should you do? How do you protect yourself while still maintaining intimacy? Get tested together. If you're starting a new relationship, or if you're not certain about your partner's STI status, I strongly encourage both of you to get tested. This isn't about mistrust. It's about respect and care for each other's health. Here's what I recommend. 2 to 4 weeks after exposure, get tested for gonorrhea, chlamydia, and syphilis. If you've had oral exposure, ask for a throat swab as well. 4 to 12 weeks after exposure, get tested for HIV for the most accurate results. Many of these tests are simple: urine samples, throat swabs, or blood tests. They're quick, and in many places, they're free and confidential. In the US, you can go to a local health department or clinic for anonymous testing. Use protection. I know it's not the most romantic suggestion, but if you're not in a long-term, mutually monogamous relationship where both partners have been tested, consider using barriers during oral sex. For oral sex on a penis, use a condom. For oral sex on a vulva, use a dental dam, a thin sheet of latex that creates a barrier between the mouth and genital tissue. Yes, it reduces sensation. Yes, it feels less spontaneous, but it also dramatically reduces your risk of infection. And honestly, once you get used to it, it becomes second nature. Communicate openly. This might be the hardest part, especially in cultures where talking about sex feels uncomfortable, but open communication is everything. Talk to your partner about testing. Talk about boundaries. Talk about what you're comfortable with. If swallowing isn't something you want to do, say so. If you'd prefer to use protection, say that too. Healthy intimacy is built on mutual respect and honesty. If your partner pressures you, dismisses your concerns, or makes you feel bad for wanting to protect your health, that's a red flag. Hygiene matters, but don't overdo it. Basic hygiene helps. Showering before intimacy, keeping the genital area clean, these are good practices. But here's what not to do. Don't use harsh soaps or douches internally. For people with vaginas, the vagina is self-cleaning. It has a delicate balance of healthy bacteria. Overwashing or using scented products can disrupt that balance and actually increase the risk of infection or odor. For people with penises, regular washing with mild soap and water is enough. No need for anything extreme. What about taste? People often ask about taste. You've probably heard that eating pineapple makes semen taste sweeter. There's a grain of truth to this. Diet can influence the taste of bodily fluids to some degree, but the effect isn't as dramatic as the internet makes it sound. The most effective thing? Hydration. Drinking plenty of water keeps bodily fluids less concentrated, which can make them taste more neutral. A diet rich in fruits and vegetables may help as well, but don't expect miracles. Let me bring this all together. Swallowing semen during oral sex, from a purely digestive standpoint, is not harmful if your partner is healthy. Your stomach can process it like any other substance, but the real question isn't about digestion, it's about infection. Gonorrhea, chlamydia, syphilis, herpes, HPV, and HIV can all be transmitted through oral sex. If you don't know your partner's status, the risk is real. The good news? You can be intimate and safe. Get tested together. Use protection if needed. Communicate openly and honestly. And never let anyone pressure you into doing something you're not comfortable with. I had a patient once, a man in his 60s, who came in worried about oral sex because his gums sometimes bled. He was starting a new relationship and didn't know what to do. I suggested he and his partner both get tested. They did. Everything came back negative. And he told me later that going through that process together actually brought them closer. It built trust. That's what I want for you. Safety doesn't ruin intimacy, it deepens it. If you've had unprotected oral sex and you're concerned, don't wait. Get tested. Most STIs are treatable, especially if caught early. And if you're starting a new relationship, make testing part of the conversation from the beginning. Your health matters, your comfort matters, and you deserve to make informed choices about your body. Thank you for being here today. I know these topics aren't always easy to talk about, but having accurate information is empowering, not embarrassing. I'm Dr. Naraya Wolf, and I'll keep having these honest conversations with you. Take care of yourself, because you're worth it.